At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit HSA.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
Once again, thank you for tuning in for another episode of Healthcare Today with the HSA. I'm your host, Chuck Taylor, and today I have with me Dr. Dwaine Cooke. He's the consultant neurosurgeon over at the Health Services Authority. Thank you so much for stopping by here, Dr. Cooke.
Well, first of all, thank you. Thank you very much, Chuck, for having me here today. And yes, I am enthused to be here to tell you a little bit about myself and the work that I do. As you said, I am a consultant neurosurgeon. I've started just about 6 months now to work at the HSA. It's been a good time getting inducted into the Cayman Islands and working in the healthcare system and doing what I do best.
Okay. And I think that's the thing that people appreciate when you have that love for what you do. You know, the information flows. You're always learning new things. You're always perfecting your craft. And I was reading thousands of surgeries.
Absolutely, yes.
Thousands of surgeries prior to your tenure here at the HSA. You worked in a Jamaican Kingston Public Hospital, Bustamante Children's Hospital. A lot of my listeners will know that from the Shaggy fame, of course. He's one of the benefactors over there. The Andrew Memorial and Medical Associates Hospital. The list is almost endless.
Yes.
Literally. Tell me how you got involved in neurosurgery.
Yeah, so from ever since I was a child growing up, I knew I wanted to do medicine. I had parents who were frequently in the doctor's offices or hospitals, and they, it piqued my interest as I had a medical guide book at home, which my mom had just to enlighten herself about medical conditions. And I got an interest in it. I started looking through this book from as young as 7 years old.
Wow. It made sense from then.
Yes.
Incredible.
And I knew from then that, yes, this is what I wanted to do. And before finishing high school, I knew neurosurgery was my calling.
Right.
I recall giving my introductions in our well-known Schools Challenge quiz in Jamaica.
Okay.
And in introducing myself, I told them that in the future, I will become a neurosurgeon.
Wow.
Almost predicting the future.
That's awesome.
Yes.
And that to me is the dedication when you are passionate about something.
Yes.
It is, it's funny because in you saying that, I think back of my own experience. I'm terrible with numbers. I'm terrible with names. If I drove down the street, I probably wouldn't even remember that I drove down. But if I heard 2 bars of a song, I can tell you the name, the era, the instrument. That just became my thing.
Yes.
And I can see that neurology has become your thing.
Absolutely.
By far. So you're a fellow associate of the American College of Surgeons, and the folks, you really got to check out this credentials, because one of the things I always love is who you are isn't defined by what you do so much, but the intensity of where you look for perfection.
Yes.
In other words, you know that for me to be the best, I need that piece of paper from that group.
Yes.
Because they are the best.
Absolutely.
I need to be inducted into that era, because that is where the best information comes out from. This will up my game. It will up my level to be the best. And so, kudos to you with the education background. From Westmoreland,
yes,
Jamaica?
I was born in Westmoreland, Jamaica. I am one of 5 children from my mom. Only boy, of course.
Wow. So that's another conversation. Growing up with that many sisters, that's another conversation.
Yes, it is.
Oh man, that's really, really incredible. And then so Offbeat, do you remember the book that your mom had?
Right. So it's called the Medical Companion for Home. So it was a general. I remember my mom's sacrifice to get this book at the time.
Right.
It was quite thick, many leaves to it, and she basically had the salesman passing through the community one day, and he stops by and he's like, "I have this book. I think you'd be interested in it." And she's like, "Well, I'll think about it." And at the time, the cost was. It wasn't cheap.
Right. Yeah. Yes. As understandable. And folks, for you who, all the young listeners, back in those days, you had people selling you the encyclopedias. They sold medical books. They sold dictionaries. They went from basically district to district, and that was their job, which was selling books.
Exactly.
Because we didn't have libraries in all the districts in those days. And there definitely wasn't an internet that you could two clicks and you can find information on.
Yeah.
So books were the medium back then.
Absolutely. And she invested in it. Wasn't able to pay for it all at once, but she paid for it little by little. And we had it. I remember using that book for years. I mean, even when I started understanding the body a lot more with science and everything, biology, having done so in high school, I could still go back and relate to a lot of things that were there in that book.
Okay.
Yeah.
And that's the progression of it. Information is built on information.
Yes.
So it's a great stepping stone. As a neurosurgeon, tell me what diseases, what do you treat? I mean, because I'm thinking just the brain. And I would assume that would be a wrong assumption to think that it's only the brain.
Oh, so right. So the word neurosurgeon, if you break it down into neural, for the nerve or the neural system, so that encompasses the brain, the spinal cord, and the nerves that come off both structures. So pretty much any particular disease that requires surgical intervention that affects these structures. So we do manage things related to infants, newborn, and young children.
Okay.
Common things like hydrocephalus, brain tumors, blood vessel problems in the brain and the spinal cord.
Wow.
Degenerative diseases that affect the spinal cord.
So would that include also like tumors and things of that nature?
Absolutely. Brain tumors, spinal cord tumors, they are, all things that present to us. Basically, we spend a lot of time in training, preparing for these cases. And certainly, since I've been here, I've basically had a broad range of cases.
Wow.
Yeah.
And I think the understanding of what you do helps with our listeners, because I had to look up it, and one of the things that I realize is that epilepsy surgery is part of it. You're talking that's seizures when you are unresponsive to regular treatment. You need to go into and these are things that you perform on a regular basis.
Yes. So wow. Yes, one thing I found when I was growing up and training, I realized that the management of epilepsy, particularly in Jamaica and the rest of the Caribbean, was quite lacking. In that we've not moved very far from the old days when it used to be considered an affliction on individuals, and to this point, a lot of the knowledge that's out there, both from the medical side as well as to the patient themselves, is lacking. And I think that's something that I decided, having gone away, experienced what it's supposed to be like in a first world setting. I see where there is a role to improve that care that we give to that set of persons.
Okay, and so I was reading as the Caribbean representative for the Young Epileptic Section. That's the International League Against Epilepsy.
Yes.
Do you see that a lot in the Caribbean? Because I mean, I'm trying to. Sorry, folks, I'm trying to put this in a right connotation. So in the older days, this was considered an affliction, something that was kind of, I don't want to deal with it. It was very hidden from the public view.
Yes.
It wasn't considered, something that was treatable, helpable. It was, something you got to live with. Has times changed?
I'll tell you that, I mean, just for the general public, epilepsy is when you have repeated seizures over a very short period of time, within 24 hours, right? Now, that diagnosis is something that we're, handing out more and more because, the health care providers have been trained and to identify.
Okay.
Yeah. And yes, in the past, it was considered something like a stigma. So, I mean, it still is in some areas, in the more rural areas, it is considered as, the persons who are diagnosed with epilepsy are stigmatized. They have difficulties getting jobs. They have difficulties maintaining relationships. They are usually very poor. And so they're not, and they have a long-term illness that requires access to medications that they can't afford.
Okay.
And as a result, they continue to have seizures terribly, and that affects their lifestyle. So we've found that, what we've noticed is that is something that has affected a lot of the Caribbean islands because of the knowledge, the information that is available to the general public is lacking in a way, as well as
it's minimal.
Yes, and it's something that the International League Against Epilepsy, which is a worldwide organization, have been reaching out, trying to get more and more healthcare providers on board to see how best they can improve healthcare towards the persons with epilepsy.
Wow. Okay, Doc. If you're just tuning in, this is Healthcare Today with the HSA. I'm your host, Chuck Taylor, and I'm talking to Neurosurgeon Dr. Dwaine Cooke. We're going to be back in just a few moments. The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit HSA.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
If you're just tuning in, this is Healthcare Today with the HSA. I'm your host, Chuck Taylor. And with me, I have Dr. Dwaine Cooke. He's the consultant neurosurgeon over at the HSA. We were just talking about epilepsy, living on islands like how we, because we are West Indian by birth and by descent. So when I talk this way, I know you and say, being grown up in that kind of idea, what can we do to help change? Moving forward, because we try to put it well. I see it over there, but how do we change?
So I think it all starts from the grassroots. What information is passed on? I think this is something that we all have to change from the schools, the young kids, to let them understand what this disease is. Just the same way I was able to acclimatize myself with the medical jargon from very early, looking in a medical book, understanding, hey, there's a sickness here that's called epilepsy, and this is something that is treatable. It's not the person's fault. This is something that they were either born with or they've acquired during their lifestyle. And if
it's treatable.
It is. And if we can change the general thought of the population, it is something that certainly not only will the rest of the population accept, but also the patients. If they realize that, hey, everybody's not gonna chastise me because I have this sickness, they're gonna feel like they're gonna feel accepted, one, and they will feel like they don't have to hide when they're going in for medical care.
Exactly.
Yeah.
And I think that what people forget sometimes is that the brain and the neurological system are very complex. It just takes 1 millisecond of something to trigger and change your demeanor.
Yes.
I remember as a DJ, one of the things were we used to, the flashing lights was a trigger. And I remember in a club one time playing, and immediately I saw somebody look like they were out of control.
Really?
Yeah. And I immediately turned off the lights. That person, and it was just by chance, because you as a DJ, you're always watching the crowd.
Yes.
And the movements were not of a dance. It didn't look normal.
Right.
And that, when you say that, then it triggered me. I said, yeah, that person is having a seizure.
You are absolutely right.
And literally, I was like, security need to get to her, and just by chance, I remember growing up, you got to make sure they put something so they don't bite their tongue. So you saying that reminded me of this, and this happened many moons ago.
Wow.
But that was one of the cases. And it literally was one of those stop moments, and within 2 or 3 minutes, it was over.
Okay, yes.
But that 2 or 3 minutes was probably the longest minutes I've ever been in because I was fearful.
Yes.
I had no knowledge. It was just, I just being in hospitals and, being around, I was like, that doesn't look right. I think she's having a seizure.
Right. And I'm glad that you picked it up, because, in some... in the medical field, actually, sometimes when we do monitor patients with seizures, and when you want to prove that they actually have seizures, you have them in a controlled setting in a hospital room, and to trigger it, sometimes you give them flashing lights. So certainly the flashing lights in the clubs and generally in the outside world can trigger it. Yes.
Yes. And it's so funny because nowadays, sometimes videos and things like that, they'll have disclaimers and things of that nature because of this. I mean, over the years. And so the understanding is that we're understanding more.
Yes.
We're moving forward to say, that this could possibly happen to someone in the general public.
Yes.
So, it's one of those things I think that we push ourselves. Knowledge is power.
Yes.
And the more knowledge we have, the more understanding we have, the better we'll be equipped for whatever life literally throws at us in those instances. So
Absolutely.
let me digress back a little bit. Graduating from
Manning's
High School. Yeah. Which university did you go to?
So I left the Manning School and went to University of the West Indies, Mona campus in Kingston, Jamaica.
Mm-hmm.
And this is the first time I'm leaving home. Of course, mama's boy, growing up in the country, going to Kingston. Of course, living on hall for the first time. I'm here taking care of myself, doing my own groceries, doing my own cooking. Of course, yeah.
With so many sisters, I'm sure it was a culture shock.
Of course,
and literally like, wow.
It was. But I felt prepared in a way, because my mom ensured that I had basic skills.
Right.
Leaving home, she's like, yeah, if you're gonna be leaving home, you're gonna be able to cook your own food.
Yeah.
You're gonna be able to wash your own. Yeah, exactly. and that's exactly what happened. And for the first year, I felt, even though it was a new thing for me, I'm here in a new world. I feel like, I have my own independence somewhat. Of course, I still have to call home and go home every now and again. But I felt, it helped because it took, I saw other individuals coming from the rest of the Caribbean, first time leaving home. It took a little while for them to adjust.
Right.
And that period tend to be longer if you were sort of the person who were reliant on others. But for me, it worked out well because I was able to start university, start my classes, and I was, from day one, I was on top of things.
Right.
Yeah.
Moving in the right direction,
yes.
as they say. And I think, that comes back with, I'm trying to rack my mind. I don't think I've ever heard of a teen graduating high school saying, I'm going to be a neurosurgeon. Now, mind you, I may have, but it was probably something that I probably brush off, with doctors, lawyers, never that specific.
Right. You're absolutely right. I think I had it in mind, and going through medical school, of course, at this point, you're now being introduced to different specialty areas, and there may have been others that may have piqued my interest along the way.
Right.
But I still just, as we went along, I was like, okay, nope, this one is eliminated. And I just kept on focused on that one.
Focusing in.
Yeah.
Hey, do you think it was because you enjoy the idea of helping others?
Absolutely. I had that caring setup from I was very young, with ill parents and so on. And I said, each time a patient comes to me, I like to, if I give them advice, I tend to tell them, with a caveat, of course, that this is something that I would have advised my family to do.
Families, right, exactly.
I want them to understand that, hey, this is not a personal benefit for me.
Right.
This is based on what I think would be the best for you.
Of course. And I think patients are understandable of a doctor's empathy because very rarely we get to hear this side of you, this story, this they think, oh, you know what, he's a doctor, he this was something he fell into. a lot of times, I like to know the background of people because that is almost understanding of where they're coming from, who they are. Being a neurosurgeon is you.
Yes.
That I can see that just by, the conversation, the spark in your eye when you talk about your history and your understanding. And that makes me feel good because I feel like if I had a life-threatening situation, you're the first person I would want to walk in and say, okay, I got it covered.
Thank you. Yeah.
I know exactly what I'm doing, and here's what I suggest. This is what we're going to do.
Yes.
And that is the confidence that you want with somebody who you're going to be, putting your life, your hands into.
Absolutely. Absolutely. You raise a very good point there. I mean, you don't want your doctor to be hemming and hawing or just like guessing, in a way when and you want somebody who is confident and not overconfident, because you also want somebody to tell you, look, this is out of my league. Somebody who's going to be honest with you as well.
And that's a part of knowing who you are.
Yes.
Because if something comes to my desk and I'm like, you know what, guys, this is a little bit out of my league.
Yes.
Let me get a second opinion. Let me find the answer that we're looking for.
Right.
And there's no shame or no thought that you are less because you don't know the answer. Because I'd rather someone be honest with me, say, you know what, I don't know what's the problem, but we're going to find out.
Yes.
I'm more respectful of that.
Absolutely.
Because that gives me, that's renewed confidence of, you know what, we're going to figure this thing out.
Right.
You know, whatever the scenario is, we're going to deal with it. And I don't want to dive into, I guess, patient history, but I'm sure there have been many life-saving situations that you had to basically scrub up and jump right into.
Yeah, absolutely. I mean, you feel like you're prepared for the battle and you're basically there and you're just aching to go. Mm-hmm. And I mean, having worked in multiple institutions around the world, not only in the Caribbean, but in Canada, US, and so on, you have the skills and you're basically on the ground now waiting to go.
Right.
And whatever comes to you, you try your best to help. So far being here, I mean, I've had some challenging cases and some that have been, rewarding. I mean, there have been a few patients that have come forward and actually given their feedback, positive feedback about the quality of care that they've gotten,
right,
and been happy with their outcomes. Some of whom have given permission for us to mention.
Well, if you're just tuning in, this is Healthcare Today with the HSA. I'm your host, Chuck Taylor, and I'm talking to Neurosurgeon Dr. Dwaine Cooke. We're going to be back in just a few moments.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit HSA.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
If you're just tuning in, this is Healthcare Today with the HSA. I'm your host, Chuck Taylor. And with me, I have Dr. Dwaine Cooke. We live in a small community.
Yeah.
And it's always, 90% of the times, someone will come to you because they're referred to you. It's like, oh, he's a great chef. You should go see him. Tell him that, John Michael sent you, or a hairstylist or a nail tech, So it wouldn't surprise me that people refer doctors.
Yes.
it would not be because, like, oh, this person, he's a, and doctors do it also. They refer doctors to patients to other doctors and things of that nature. So it wouldn't surprise me that we do have a few patients out here who feel so relieved to have that, maybe pain management, some sort of trauma that they went through, to tell people, hey, you know what, I had this, I was dealing with this, and Doc here, he took care of me. It would not surprise me at all. And if I could, I see one here that popped up on my sheet. One patient, Mr. Andrew Yates.
Yes.
So tell me a little bit about his condition here.
So I mean, the challenges with Mr. Yates is that he was had fallen down and had been experiencing some pain in his lower back and had been suffering for quite a while. Tried numerous measures to treat the pain, and all of which wasn't settling or wasn't helping. And at this time, he himself had some concerns with with the treatment options, given that he tried a lot of them and they hadn't worked. So the next step would have been to try surgical treatment. When we eventually got to that point, not many persons want to have surgery. You have to understand that.
Yeah,
and you have to sit down.
That's a last resort.
Yes.
But by far.
So he was, we're able to go through and, had discussions and made sure that, he was understanding everything that was going on. And these were the benefits of surgery. And we had a successful surgery, and he's doing very well now, recovering, rehabilitating, and is very happy for the new lease on life.
And I think that's the thing that we all want, and part of it is after we've done so, they say, okay, try this, try that, try this, and you get kind of disheartened with the process.
Yes.
Yes. And for all my listeners out there, sometimes it's a process of elimination.
Yes.
And I'm saying that because I myself have gone through some things in life and was like, oh, I'm in pain. I'm walking and this and this, and they kept trying and they kept working and like, okay. And you get to that point that it's like, oh man, okay, we're going to go do surgery. Okay. All right, this is it. I put it in your hands, Doc, and here we are.
Right.
And the outcome, when it's favorable, you're relieved.
Yeah.
And sometimes favorable is better than it was before.
Exactly.
It may never be 100%.
Right.
It may not even be 99 or 90%, but you were operating at 10%, 15%, and it's 60, 70, 80%. It's a lot better. It's manageable now.
Right.
It's understandable. And that's the thing sometimes that, I'm glad that we can fix us technically.
Yes.
Because we will never be perfect unless we're born again.
Exactly.
but what doctors and hospitals have done is giving you an option to make it better.
Absolutely.
And I think, kudos to the HSA for all of the things that, they've been putting together, and also the vision to find people such as yourself.
Yes.
And I thank them for that, because we want the best.
No, right. Absolutely.
And sometimes it's not in our pond. We got to go outside of our own pond to get that.
Yeah.
And thank you so much for coming here and assimilating to us.
Yes. No, absolutely. I'm very happy. It's having visited here during the pandemic. At least I got an exposure to things, and saw the work that HSA been doing in terms of getting their healthcare facilities up, and the level of care that's being provided by the staff, and I felt like, wow, this is who I want to be a part of.
Right.
Exactly.
And that's just it. I thank them for creating a world-class facility that can be attractive to people.
Yes.
Because I tell people all the time, over the years, a lot of medical television and medical shows have chopped up. And mind you, folks, they are shows, and they do have, technical people that kind of do the background, but they are shows.
Yes.
But I think one of the things that they do is show that doctors and medical professions are human.
Yes.
You get tired.
Absolutely.
You look for the best working scenarios. You look for a safe environment for yourself, for your family, for what you got to do. And I think that was one of the things, because over the years, we are able to talk to a doctor rather than being talked to. We can a doctor would say, so Chuck, what's going on? Doc, I'm having an issue with this. My father, God rest his soul, said, outside of your wife and your family, there should be 3 numbers you have. And I always used to laugh. He said, one should be a doctor. One should be definitely a police officer.
Okay. Yes.
And the other one should be somebody that you trust, like a priest. So that you are able to call somebody at any given time that they'll answer your phone, be like, hey, everything okay? Because you never know when you might need someone's services.
You're absolutely right. Good advice.
And thank goodness, the old man, he was right. As most West Indian kids say, dads were usually right all the time. Oh yeah. But these were one of the cases where it is. So coming back to some of the patients. One of them is Mr. Selvin. I see his name here. Tell me a little bit about that scenario.
Right. I mean, one of those cases that we've been discussing seizures and epilepsy, earlier on. And I mean, Selvin presented to us, on one of those occasions, having had an episode of seizure, which basically, while operating a machinery, basically, had to, which repeated itself. Of course, the seizures occurred repeatedly and had to be hospitalized. And during this period, he was found to have a brain tumor.
Wow.
Yeah.
So was the brain tumor triggering the seizures?
Correct. So brain tumors are abnormal growths that occur in the brain, and they sometimes have the normal cells or abnormal cells in the brain that just propagate into a cluster, into a ball. And if they irritate the brain, because the brain is basically a series of electrical circuits. And if the brain tumor irritates the brain, you're going to have lots of foci firing coming off. That's like a seizure. And you can have depending on which part of the brain is affected, you can end up with just one part of the body twitching, or if the entire brain is affected, they can lose consciousness and the entire body convulse, as in the general jerking of the limbs and so on. Right. So in this case, yes, a large tumor was about the size of a small potato was identified.
Wow. And he was driving a vehicle at this time?
Yes.
Man.
Yeah. So, I mean, that nothing, bad happened in that incident, but, he was, it repeated itself to the point where he had to be in hospital.
Right.
And despite lots of medications, it took a while to get it under control.
And see, that's one of the things, I mean, and I love my West Indian people. I love you, so don't take this the wrong way. We have a tendency to work through pain, work through things. They're like, my hand went numb. Okay, your hand went numb. Okay, no, it's just because I wasn't moving. All right, your hand went numb again. There may be something, but we tend to kind of wait and fight with it. We fight with ourselves.
Yes.
We tell ourselves we're okay. Where sometimes it may be good to go get a little checkup. Right. It's not gonna knock you out. And I think that is where we need to get better with ourselves. We need to, and me, I tell people, I said, I'm the worst at it. I can be in pain walking around like, Chuck, you okay? Yep. I'm just, my leg fell asleep. and till at some point in time, we have to recognize that we do need assistance.
Right.
And I think that's one of the things that and me being a West Indian man, I am so guilty of it. I'm like, don't worry about it. It'll pass.
Yeah.
And sometimes I have to catch myself because I hear the older versions of us talking there and saying, no, babes, let's go get this checked out. Let's
Yes.
go. Let's go. Make an appointment. Have this looked at.
Yes.
Because sometimes it can lead to something that is
More
more
serious.
serious.
Yes.
And life threatening.
Yes. Absolutely. I mean, in this case, it happened so suddenly that within a very short space of time, all this had been happening, and got pretty good evaluation.
Okay.
On admission. And of course, the problem was identified, and realized, hey, this tumor needs to come out to stop this. Yes,
because they grow by the second and by the minute.
Oh yeah, I mean, depending on what quality of what type of tumors, you have some that are slow growing and some that are more rapid. They grow, yes, by the second. In this case, it was not only growing in itself, but it was also causing swelling to the brain around it.
Oh wow!
Yeah.
So when things, and this may be a different scenario. Suppose swell. Do you induce coma sometimes for things of that nature, and to help relieve the pressure on the brain? And is that even, because I remember seeing that and saying, aneurysms and different things like that. Give me a little bit of scenarios with those. Right.
So certainly, if you understand that the brain itself, it can get injured, and injury can be inflicted by trauma. It can be inflicted by bleeding inside the brain, or even a stroke where there's an infarction, a part of the brain loses blood supply and the cells die, they swell. There isn't a whole lot of space in the brain for that swelling to go, because
right.
the skull doesn't swell with the brain.
Okay.
So, when that happens, you have to find ways and means to get the swelling away.
To calm it down.
Exactly. So to do that, we can give them medications to try and shrink the brain a little, and keep them in a state of rest. So put the body in a state of rest. So put them in a coma. So you give them medications to do that while they're on a ventilator or a breathing machine. And
to basically force the body to rest and recover.
Exactly.
Okay.
Exactly. And that, if that doesn't work, then sometimes you may have to, treat the underlying problem. So if there's a bleed, a hematoma, or blood clot in the brain, you may take it out. If there's a brain tumor that's there,
right,
you remove it. And
is that Cayman and my people, I love y'all again, but y'all got to slow down with the car driving and things of that nature.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit HSA.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
If you're just tuning in, this is Healthcare Today with the HSA. I'm your host, Chuck Taylor. And with me, I have Dr. Dwaine Cooke. We have a lot of accidents on our island.
Yes.
Head traumas,
yes.
Things of that nature. Is that something that we can see about? Because, immediately I think, a lot of drivers, no seatbelt. Hit something, automatically there's going to be trauma there.
Yes.
Is that something that you look at also?
Absolutely. What I've noticed in the Caribbean, and I'd say Caribbean because having been in Jamaica and so on, one of the biggest things that we saw on a daily basis is trauma.
Okay.
Preventable injuries. So, and I'm not only talking about the motor vehicle accidents,
Right.
the bike accidents, the bicycle accidents, but also the domestic violence, the gunshot,
Yeah.
the stabs, hitting the head with a stone, hitting the head with a baton, whatever.
Right.
Now, these are all preventable. Now, we can start from on the roads, yes, defensive driving, wearing helmets. That saves lives.
Reduce it by 90%, if not more, folks.
Yeah.
So we're
Wearing your seatbelt, that saves lives. And a lot of these domestic disputes, I mean, there are some things that we have to go back from grassroots, from the home, where we try to address some of these issues, how we solve
domestic,
conflicts and so on.
Exactly.
Those are issues that we have to start from the grassroots. I mean, yes, I see on a daily basis. I mean, not so bad here in Cayman as I would have seen in Jamaica, but there are, motor vehicle collisions and accidents that cases that come in. Some of them very severe injuries. I think sometimes I say to myself, if others were able to see what I see, they would be very cautious.
Yeah.
They're able to see what the outcomes are or so on. They would definitely
they
change.
would definitely change the and I think that it has to start somewhere, and maybe the end is kind of where we need to start and have that conversation, because it's for me, over the years I've lost a lot of good friends due to bike accidents. I was an avid rider when I was younger. Oh man, I would jump on a car, I would ride. But for me to get on a bike now, I think my family, and I think, okay, am I mature enough to ride this properly? Am I gonna not feel like a 15-year-old and jump on a CC, and just ride out? And so part of it is knowing that, I buried some really good friends over the years.
Yeah.
I've buried in closed caskets kind of things.
Wow.
So I think back, say, okay, you know what? They were in an accident, head trauma.
Yeah.
2 weeks ventilator. Finally, they pull the plug.
Yeah.
And I'm like, wow. So part of me is always aware of that.
Yes.
But then talking to someone who's seeing that person on that table, and folks, I'm being very honest with you, and I hope you can understand what I'm saying, because this may be something to help save your life.
Absolutely.
This may be something that you can, some of it doesn't matter, young, old, you just have to be cautious, because you never know what can happen a minute from now.
Absolutely. I mean, we could sit on a whole show just talking about this head injury and how to prevent it. I mean, this is probably where we need to push. Yes, it's nice to have a lovely hospital, a lovely intensive care unit, a good doctor, brain surgeon around, but we have to start talking about prevention.
Right.
And I think that's something that we need to push more off. Cut back on the drunk driving. Be more cautious when you're in the vehicle. Be attentive. Wear your seatbelt. Wear your helmet. Don't get distracted using your cell phones. We could use a whole session talking about this.
Because at the end of it is not going to be good. No. It rarely ends on a positive note, because your head and your spine are so delicate. People, I tell people, I said, we used to do boxing and stuff like that. And literally, why do you think, even now I think back, said, you know what, the cushions that we had in our head for American football and things like that wasn't enough.
No.
wasn't nearly enough.
No.
And literally, I remember, because I'm a pretty big guy, I played sports like that, and come on, and they said, what's the matter? Head ringing. Oh, go, and they're like, oh, go get an ice pack. Because you literally was overheating, and you were hot, and you were hitting your head, and all these kind of things.
Yeah.
And that is trauma.
Yes.
Whether we believe so or not, that
can be detrimental to your health in the long run. I said, look at like Muhammad Ali and people like that. I mean, he's more well known, but he's kind of the far end of the spectrum, but he is the spectrum.
Right. I mean, what we need to understand for us, the brain itself is fairly young in terms of what we know about it, and it's constantly evolving. And you'll find that there in 10, 15, 20 years, we're still discovering things about it. Mm-hmm. And a lot of things today that we think are normal or acceptable may be found to be harmful to the brain in 20, 30 years down the line, because that's when some of these things manifest themselves. And certainly the point you raised with repeated trauma with boxing and American football, they are all things that we've discovered over the last decade or so, having, had persons who've been exposed to these injuries years before. It's coming out, which is one of the things that I like about my neurosurgery on a whole. It doesn't stop at the time when you finish your training. Every day we keep discovering something new, and it will probably never change until until the end of my life, because
it's evolving all the time.
Yes.
So with that being said, and any listeners out there who feel the need to dive into the medical neurosurgeon aspect of it, what advice would you give them?
I mean, for me, it's important for you to know what drives you. I mean, I was impressed by you when you said that, you weren't good with the numbers when you were growing up, but you knew you could remember people's faces and so on. And this is probably one of the driving forces why you're here today. You're very good at talking to people. You're sociable, etc. So for you out there, young listeners, you need to know what motivates you, what drives you, what do you want in life, right? My driving forces were, probably won't be the same driving forces as yours.
Everyone is different, of course, right?
But you must know what you want to do. I mean, doing neurosurgery is hard work, but it can be done. Because, many persons have done it. And it's that time of your life where you're giving up very important years, of your youth, in training. You're going to make huge sacrifices to get to that point. And there are going to be challenges at time where you feel like, hey, do I really want to do this? But, if you know, what your goals are, you keep focused and you keep working hard, that care what hurdles come in your way, you're going to be able to clear them.
Right, exactly. And I think that's the thing. I mean, for all the young and teens and early 20s, that strong work ethic is important. No matter what industry or no matter what you go and do, it's just that problem-solving skill. And I think you feel accomplished knowing that you helped somebody. And that's one of the things that I take from all the things that you said. That accomplished to know that you made someone's life, you saved their life, you made it easier for them to move. You made it, it was a sacrifice, but that sacrifice get tossed aside when you see that person. You feel good about, you were instrumental in doing something. And I think that's the thing that, people need to take from this, yes, it's extensive training and education and that, but the rewards of helping a patient recover.
Oh, yes. It is rewarding. I mean, you're basically, it makes your day when you work hard on someone, who comes in and is suffering. And in a lot of, there's a lot of problems here. And what the risks are, what could have gone wrong, without treatment or with treatment, and you help them, and they're able to walk and come back to you and say thank you. You helped me a lot. It makes your day.
Right, exactly. Wow, and that's the thing. I think my listeners appreciate. And also, I'll be honest with you, I love hearing a story from a Caribbean aspect. And I'll be honest with you, I met a lot of people in this world. You know, I knock on wood, thank God. I've never met a West Indian neurosurgeon. So I was very stoked on having this conversation with you.
I am happy you did.
And you know, to tell you that alone is inspiring, to know that you are out there. People like you who are committed to the cause, who have the vision to say, you know what, this is for my region, this is for my people. This is for me also, yes, but this is for people who I would be, if I ever had an issue, you'd be the first person I call now that I know you.
Absolutely.
And I thank you so much for that. And final, in closing, any parting words you'd like to
yes.
say?
I mean, I am very happy to be here at HSA. You know, it's been a very good 6 months so far. The support from the administrative staff and my colleagues that I work with on a day-to-day basis. I have some wonderful nurses, wonderful doctors, and basically the push is to improve healthcare delivery to Caymanians and everyone around. And right. I'm very happy to be a part of the group. And yes, I'm happy to be here to tell you a little bit about the functions that I bring to this sector. And yeah, thank you very much for having me here today, Chuck. Yeah.
It's my pleasure. My pleasure at all. Once again, folks, you're listening to Healthcare Today with the HSA. And I've been talking the field of neurosurgery with Dr. Dwaine Cooke. He's the consultant neurosurgeon over there at HSA. Vast knowledge. Folks, the man credentials as long as my arm, and you know I'm like 6 foot plus. So you know, kudos to him and all that he is bringing to here. And if you ever have a need of his services or anything, he's over the HSA.
Perfect. Thank you.
Thank you so much. Tune in tomorrow, next week, next year. We will be here. We are right here on Bobo 89.1 FM.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit HSA.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.